Thank you all so much for joining us. My name is Jen Rogers. With me today are Molly Joseph, Cypress Passive Ventures Managing Partner. She's an advisor and an investor in the healthcare space. And Dr. Ali Parsa, he is the CEO of Babylon, a digital-first healthcare company. And we're going to be talking about a new approach for healthcare. It is a proactive one, focusing on prevention and also the role that technology plays in that shift. Before we get into it, I want to remind everyone that we want to hear from you. We want this to be a discussion. We would love it if you could use the text chat to the right of your screen to post questions, engage in the discussion with us. We also have a poll on here, so you can hit that up as well. And we will try to incorporate as much as we can from the chat into our conversation. And with that, let's get started because we've got a lot of ground to cover. I think it is fair to say that healthcare has been consumed very differently over the past 14 months due to COVID-19. I mean, I myself had my first telehealth visit. I've had a few now. I imagine I'm in good company with the rest of you. So, Ali, let's start with what opportunity the pandemic and patients' increased exposure to technology has presented to the healthcare industry, especially as it relates to prevention, because we've been so focused on dealing with sick people, but what is the prevention angle here that's next?
Jen, I think what the pandemic has done has forced us to rethink almost everything that we thought was solid and make us think about and made it almost melt into air, right? If you remember when the pandemic first hit, our immediate instinct was let people get sick and then we'll deal with it. And we very quickly find out that model of sick care, that instead of dealing with preventing people from getting into crises and emergencies, trying to avoid those crises and emergencies don't work. So we went all the way to, even in some countries, to draconian measures to help people stay healthy and avoid those crises and emergencies. While that worked for us really well in the pandemic, the question is, why don't we do it for everything in healthcare? In the pandemic with COVID was not the only pandemic we have. We have a major crisis in mental health, in chronic conditions. Everything else that up to now, we always waited for those crises to hit those individuals, and we went away and spent a lot of money, effort dealing with them when it was almost too late. You and I don't do that with our car. We used to do it 20 years ago. We used to wait for the car to break down. We took it somewhere, they fixed it. Today we buried so many sensors in our cars and we take it for services. And then when we do, we can basically prevent our cars from breaking down. My car doesn't break down anymore. I'm sure yours neither, because we dealt with it differently. We need to change our lens, and instead of dealing with crisis, we need to make sure people stay healthy, and that can be done with technology. Technology is a tool. All it does, it allows us to look after somebody ahead of time, collect data on them, and try to prevent the situation before happening. It's not about technology, it's about the way we do healthcare. Do we wait to deal with sick care, or do we do what says on the tin and keep people healthy?
I mean, Molly, I want you to jump in here because we're kind of just addicted to this fee-for-service system. I mean, you can hear the ideas out there about changing, but the legacy system is so entrenched, right? I mean, it's a huge problem.
Well, I'm not sure that I see that we're addicted to fee-for-service. I actually think there's been tremendous amount of innovation around the space over a pretty sustained period. You've seen innovation in a shift towards value-based care and risk sharing. There's certainly been a lot of digital innovation. Innovation, in reimbursement models. But to me, the really powerful shift in 2020 was as consumers and clinicians adopted a digital first or digital acceptance. It put consumers into a different position relative to engagement in their own healthcare. So, you can start to leverage all the innovation around AI and machine learning to start to make that more of a customized consumer experience, to start to bring simplification to a really, really complex system to navigate. And when you can empower a consumer like that, you begin to see a much, much better downstream impact around all of the efforts on prevention that Ali talked about.
So I'm looking at some of the comments in here. Jay Goth just talking, we need to get back to basics, nutrition, exercise, mental health, which Ali also brought up in there, comorbidities that are a main contributor to serious COVID illnesses. So to take that analogy right about the car, the oil change, like the really simple stuff, how do we leverage technology, Dr. Parsa, now that we've become a little bit more familiar with it in the pandemic?
Well, in the same way that we leverage technology everywhere else, right? So we need to kind of think about in what point in this chain do we need to put technology in place. Like, let me give you another analogy. It's a very simple one. Imagine if you took a dental insurance policy, whatever you pay for it, let's just say $1,000. And then you just went to your dentist. Your dentist waits until something goes wrong and says, hey, sorry, Jen, I have to do a root canal, $10,000 here goes to the insurance company, right? Imagine now if the insurance company goes back to the dentist and say, hey, here is $1,000 that I get from Jen, is yours now. You look after her. What would the dentist do? He or she is going to find you wherever you are, bring you to the office, do a full checkup on you, make sure that they try to prevent it. Then they ask you to, hey, can you call me every month so I can do a checkup on you, and so on and so forth, because it's now their responsibility. So what the thing we've done, we've just changed the responsibility from dealing with sickness to keeping you healthy. Now, all technology does is enable us to do that at a more scalable way. Because you can imagine this can happen one-to-one with your dentist. It's just that your dentist cannot look after a very large population that way. So all that then the technology does is, if I need to bring you in, instead of bringing you in, can I do that remotely? If I have to do it one-to-one, a human to human, can I use artificial intelligence to do with some of the tasks that a human would have done? If I need to collect data on you, can I use tools? Can I use your mobile phone to be able to use its capabilities? For instance, take a picture of your teeth and then let the AI to do some analysis of it, that kind of stuff. People make technology into scary thing. Often we as human beings, we love to be seen as too intelligent, and therefore all we do is too complex things. Things are often, you need to go back to the basics and say that what is the basic problem I'm going to solve? What is the solution? And then how am I solving it, and what tools do I need for that? And I think if we can get to that basic thing of that, keep people healthy rather than get the crisis part, then technology is just a tool for that.
And Molly, when we talk about this digital first and role of technology, I mean, I think everyone has probably had this experience with their own doctors or their healthcare. Right now, it feels really piecemeal. It's like, okay, somebody added an iPad, or there's a new portal for records. But for meaningful change to happen, like we're hearing Ali talk about, is this an overhaul of the entire system to be able to have AI have an impact here, or can we do this with so many legacy applications still hanging around?
Yeah, I don't think it's an overhaul of the system. I think there is an opportunity to bring together best-in-class technology and best-in-class healthcare models in a way that we really haven't, because both industries have been developing separately. So it's really about bringing that together and then leveraging, a lot of longstanding investment that we've seen from employers, insurers, governments. Anyone who's funding healthcare has been investing in preventative health. And to me, if you were to look specifically at two models where this really makes an impact, it's a virtual primary care model, and that takes annual wellness. It takes chronic condition management, it takes lab and script management, and it gets all the way to how do you optimize specialist referral patterns. So that's number one, that's powerful. And then number two, if you look at a digital behavioral health model, so that's, that helps consumers avoid any perceived stigma. It gets to convenience, right? You eliminate some of the inconveniences of regular care and commuting to it. And then importantly, it helps our providers, our clinicians, with productivity in a really imbalanced supply and demand area of the healthcare system. Those two models alone, that's not an overhaul, but it's a huge improvement.
Ali, tell us what Babylon is doing in this regard, because as we're talking about ways to solve for the problem, I mean, what is the solution that you're presenting that you think can get us there?
So I think all we do is, on one hand, we are big believers in what you call value-based care, which means aligning the incentives of the payer, the provider, and we are fundamentally a provider, and the patients, by saying that the job of the provider is to keep the patient healthy and not deal with them only when they are sick. So on one hand, we are all about how do we do what I described earlier, is to take care of you upfront rather than get you to crisis and emergencies. On the other hand, the problem, and by the way, there are lots of value-based providers out there and they do a great job. Many of the audience are healthcare professionals. They know that. Their fundamental challenge is that they're brick and mortar based. They have clinics. They have to bring the patients into those clinics and deal with them there. And that's not very scalable. You can't do that across the state. You can only do it in those locations. So what we do is we use technology, because what digital health companies have done, they have shown that how this can be done at scale using technology, but without all those barriers. However, usually digital health companies just deal with a very small part of the problem, which is just urgent care or telemedicine, so on and so forth. But we, on the other hand, try to do it across the spectrum for all of your healthcare. That's what we do in Babylon. We bring the value-based care model of healthcare and the digital model of healthcare to create a digital first and therefore highly scalable value-based company. So if you look at it in United States, in 7 months since we launched, we now have 90,000 lives under management, where we take full of the risk and full of the budget. Most value-based companies are at 50, 60, 70,000 people after 10 years.
I love, while you're talking, the chats have really been going. You guys are doing a great job out there hitting on some of these key issues. And I want to bring up the poll right now. So look, we have this poll out there. Healthcare as we know it is mostly about sick care. The traditional approach to healthcare is not working. How do we think healthcare can be re-engineered? And it's really interesting because it's getting very mixed results from everyone in the audience. Molly, I want to know, does that surprise you at all that we've got 30% of respondents that feel in-person will only happen when absolutely necessary? That we're even divided on our little poll here on how to move forward. That 30% of respondents feeling in-person will only happen when absolutely necessary. What does that sound like to you?
It doesn't surprise me, because I think we're all seeing the broad application that digital can have along the entire healthcare continuum. And there is absolutely a very, very important space for in-person care, no doubt. But downstream from that, what does a digital first or consumer or physician acceptance of digital do to optimize, even when you get to the necessary in-person care, in terms of making sure that at scale, we can really match consumers with the very best specialists when they need in-person care. At scale, how do we make sure that we're driving the best adherence possible to evidence-based clinical care protocols? It's not just care is a digital visit, it's kind of the extension and the benefit of that across the ecosystem. Very consistent with what Dr. Ali was talking about earlier. So I think we can come at this a number of ways, and I think the poll shows that.
That's what we're doing, it seems like. In the poll, people are coming at it a bunch of different ways. There are a number of questions in here, Dr. Parsa, that hit on blockchain, that hit on people being able to control their own data. How important, how sticky is that, do you think, for patients in terms of their control of their data, being able to update it all across the line? Is that something that we're going to be seeing soon in what you're offering and in our own lives?
I actually think that's the job that shouldn't be just left to the operators, because while vast majority of operators are very good, that you cannot just leave it to people to have good intentions. That's the job of regulators. I think we should absolutely make it part of regulations in every country, and some countries are coming to that way. In Europe, for instance, we saw the regulation on data happening across the whole internet with GDPR, that the data of a patient should belong to that patient. It shouldn't be the property of anybody else. It should only be the patient that allocates who can see that data, who cannot see that data. It shouldn't be traded on. I mean, as we know, trading on data outside healthcare has become an incredibly big business, right? And the danger over is that can creep, that business model can creep into healthcare, and the regulators need to fix that sooner than later. I mean, we made it clear we never sell, we never share, we never do anything with data, but that's fine. You can't leave that to companies because bad eggs can happen. And it goes back to some of the chats that people are putting in, which is about trust in the new models, right? We should almost mandate trust in this. And a lot of people in technology are against regulations. That's true, sometimes regulators can do too much, but then that should not be the case just to dismiss regulations all the time. Much of regulations in healthcare is very good. And remember, FDA was created in order to deal with the snake oil people, right? Salespeople, right? There's good role for regulations to play, and data is something they need to look at very carefully and very quickly, frankly, as we go towards digital health.
Molly, just talking about that trust piece, there was just an interview on the main stage with the head of a hospital in Los Angeles. And we all know during the pandemic, the discrepancy in healthcare outcomes. Can technology and being able to leverage it, can that actually be a more equitable solution in the long run? Or do you have concerns about equity and the next technological shift here?
I mean, I think it can be, but I think we have to be really intentional on the social determinants of health. And we have to think about that, whether you're talking about a traditional in-person care setting or you're talking about digital. Either way, those same dynamics and those same social determinants play in. And it's imperative that we're thoughtful about that. And I think, there was, in no time has that been more exposed than in the pandemic. And I saw that, that isn't a US phenomenon. That was everywhere across the world. The way this pandemic impacted populations was different, and it preyed on the most vulnerable. And then the way it impacted our bodies had some of those same variables by population. So to me, it's the same issue in both applications, physical or digital. Ali, what's your thought on that?
I think you're absolutely right. I mean, I just think that I don't have anything to add to that. You're absolutely right.
Molly summed it up. Before we have to sum it all up here, and we have about 2 minutes left, it seems like there's a lot of promise, but there still are a lot of challenges, whether it's providers or whether it's patients. Do you think it's going to take to actually make this happen? Is it government? Is it investors pumping more money? Is it patients demanding it happens? Really, what is the key?
I think it's all of the above. I think, look, a lot of people, and I see it in the chats, find the areas in which that cannot be done or things that are the exceptions. And they say, look, as long as we can get to the extreme exception, we're not going to do everything else. Remember, in any other area of advancement of technology, not the entire 100% of the population uses it, but the alternative comes as an addition to what we have in this ecosystem already, as Molly said. It took a long time for people to adapt to e-commerce, right, to buy stuff on the internet, right? And there are still many people, my mother included, who uses a lot of things in technology but refuses to buy her clothes on the internet. That's perfectly okay choice for her to do. So this dictatorial approach that either everybody needs to do this, or everybody needs to do something else, or everybody needs to do this. We don't live in the old Soviet Union where choices are mandated. We live in a democratic society in which people have got to be given the choice. So I think on one hand, providers should stop kind of thinking that it's just my way or no other way. And the payers and those who give the things should stop saying that, look, that's what I like to do, therefore my entire patient group need to do the same. We need to give people choices and let them choose.
Well, thank you both so much. That's all the time we have right now. Molly and Ali, thank you to Babylon. We hope you all get a chance out there to go check out Babylon's booth in the expo area to learn more about the work that they're doing. Thank you so much for being so active in the chat and getting us to have a real conversation here. And now you can click the stage button to the left side of your screen and tune in on our next session.